and thank you for joining us today. My name is Suzanne Roos, and I am the sales director here at the Village at Augsburg. And I know that many of you have been joining us for this series, so thanks for coming back. And to anyone who's brand new, welcome, and we're glad to have you. And I hope that you really enjoy today's presentation. It's one that I'm looking forward to. And also want to wish you all a very happy autumn, because here we are in the second day of fall. And it looks like the rain has finally let up. I'm seeing a little bit of blue sky outside. So I think we're in for a couple of really beautiful days in the next few days. So that's always a good thing. I do want to give you just a little update on what's happening here at Augsburg before Pauline begins her presentation today. As you know, many of you have heard me talking about this wonderful renovation project that we've been doing for the last several months. And we are at the very tail end of it. Our furniture has arrived. Our artwork is being installed today. All of our draperies are being installed next week. So we are preparing for a very special series of grand opening events, and you will be receiving an invitation for that. So please keep your eye peeled to the mailbox. And of course, at any time that you want to come for a visit, even if you can't make it to the grand opening, I welcome you to give me a call and set up a time for a private tour. We have a brand new model apartment that I'd love to show you. It's been very popular. It's been very well received. And we've sold a couple of them actually, so that's a good thing. So I'd love to have you come in and take a look. And lots of great things are happening here at Augsburg. We have a new chef on board, and we're looking forward to lots of his specialties. With our new bistro opening, we'll have some new menu items. So lots of great things going on here. So today we're here to learn about Medicare. And I'm very happy to welcome Pauline Gibbs. Pauline is going to join us here and give you a little bit of an introduction about her background and her experience. And then she's going to guide this webinar today. As always, this is being recorded. It will be available to you to watch later on our YouTube channel. And Adrian will send a link to you probably tomorrow in an email so that you can watch it again at your leisure if you have to pop off early or you missed something and you want to review it again. And if you have any questions at all during the presentation for Pauline, don't forget to put those in the Q&A box, and Adrian will monitor for you. So again, thanks for spending an hour with us, and I'm going to welcome Pauline to join the screen, and she will give us a little background. Hi, Pauline. Welcome to Augsburg.
Hello. Thank you. Hi, my name is Pauline Gibbs, and I work in the Kaiser Permanente Medicare department, and I have been working with Medicare beneficiaries and their children or caregivers for about 20 years. And so during this webinar, I am going to cover the A, B, C's, and D's of Medicare. After each slide, I am going to pause for a moment. So that way, if you do have questions about a particular slide, you can type them in the Q&A box, and then I can respond to them versus you trying to remember that question until the end of the webinar. And I want to thank Suzanne and Adrian for inviting me to present today. So now I am going to start sharing my screen so you can see the slides. And if you please let me know, are you able to see my slide?
Yes, ma'am.
Yes.
Okay, great. Okay, so during the webinar, this is my contact information. If you would like more information or you have questions that come up after we are done today. Okay, so this webinar is going to cover the basics of Medicare. I know there are people on the call that may be getting ready to get Medicare soon. And then there's also people that may already have Medicare, but sometimes people are not familiar with all of the different parts of the A, B, C, and D. So what is Medicare? It's a federally funded program which includes the Part A and Part B, and is referred to Original Medicare. And you can only get Original Medicare through Social Security. People, usually if they're disabled 2 or more years, they're eligible for Medicare, or if they are turning 65, they will be able to get Medicare. This program was established in 1965. It's administered through the Centers for Medicare and Medicaid Services. So who can join? I mentioned turning 65. If you or your spouse is eligible for Social Security, and then also under 65, I mentioned if you are disabled for 2 or more years, and also people with end-stage renal disease, which is permanent kidney failure, or ALS. And I'm going to pause. So if there's questions, please type them in. Okay, so first I am going to cover the Medicare Part A. Part A covers inpatient hospitalization, which is what it is mainly known for. But as you see from this slide, it also covers the skilled nursing facility care for a certain amount of days. This is not long-term care, so it does not cover long-term care. It covers hospice care and some home health care services. People do not pay a monthly premium for Part A of Medicare if they have worked and paid into Social Security for 10 years or 40 quarters. And then if you have not worked and paid into Social Security, people are able to buy Part A of Medicare, and these 2 bullets under that shows what that payment typically is. So most people do get it for no charge. And this shows the charges for Part A, because sometimes I meet people and they say, well, why do I need to get help with Medicare? Not realizing that if you only have Medicare, there are charges that you are responsible to pay. So under Part A, there is a deductible that you would pay at the beginning of the year before any of the services start. So if you go into the hospital, you're going to pay that first $1,484. And then the coverage for the first 60 days, it's no additional charge, but then you pay per day after the first 60 days. The Part B of Medicare is your doctor visits. It covers your medical. And then also, before I go more into Part B, let me pause for a moment to see if anyone had questions on Part A.
No questions yet.
No questions?
Not yet.
Okay. Also, let me mention too, with Part A, sometimes when people first are eligible to get Medicare, they may get Part A because there is no monthly premium for it if they're going to continue to work and be covered through their employer health insurance. But then they may delay Part B because there is a premium for Part B, which I'll cover a little later. And so that's typically how people do with the Part A and Part B. And then once they retire, they will pick up Part B. So the Part B is your medical insurance, and it covers your doctor visits, all of your outpatient care, your specialist visits, your lab, radiology, durable medical equipment, dialysis, and your preventive services, which is your physical exam. Okay, so this slide shows what most people pay is the $148.50 for Part B of Medicare. And that amount is usually taken out of your Social Security check. If you are not going to withdraw Social Security, then they will send you a quarterly bill. But also that amount will increase based on income. So the other sections show what that amount will increase to if you're within that certain income range. So I mentioned it's from Social Security, but sometimes people do not realize that there is also a late enrollment penalty for Part B. So if you are first eligible for Part B and you're not covered through an employer coverage, but you do not pick up Part B, you could pay a 10% per year penalty for not getting Part B coverage when you are first eligible. And if you are charged that penalty, it follows you for life. So it's not a one-time penalty. But again, if you are going to continue working and you have credible coverage through your employer, then they waive the penalty, and then you're able to pick up Part B later when you retire. So how do you enroll in Part A and Part B? During the initial enrollment period, when you are turning 65, you have 3 months before your 65th birthday to enroll in Medicare. And then the month of your birthday and 3 months after your birthday. But if you wait till after your birthday, then your Medicare will start later. But you have the 7th month period to get Medicare. And that is your initial enrollment period when you're first turning 65. There are also special enrollment periods to get the Medicare Part B and A, but like I said, most people, when you're first eligible for Medicare, because there is no charge for Part A for most people, they will get Part A and delay Part B because of that monthly premium. The special enrollment to get Part B is because you left your employer coverage. So when you are getting ready to retire, you will just contact Social Security and say that you did not get Part B when you were first eligible because you were going to continue to work. And they will give you a form, or you can go online. There's a form that you will have the employer to complete to prove that you were covered through their employer coverage. There is also another period for those that may have not had employer coverage or left the employer coverage. I think they give you like a 60-day period to apply for Part B when you leave the employer coverage. But if you miss that, then you have the general enrollment period to pick up Medicare. And that is every year from January 1st through March 31st of each year. And then the Medicare starts July 1st. Okay. And then if you have Part A and Part B, you're able to pick up a plan to help with Medicare. There are people that fall into that general enrollment period where even though they may want help with Medicare, until they get A and B, there's not much they can do until July 1st once that A and B starts. Okay. Okay, so what are the coverage options under Medicare? So when you first get Medicare Part A and B, you can choose to supplement the original Medicare by enrolling in a Medigap plan. The premiums for the Medigap plan you will pay directly. Kaiser Permanente, as you see in that note, we do not offer a Medigap plan. We offer a Medicare Advantage plan, which is the second bullet, which is also known as Part C of Medicare. And you can only get Part C of Medicare through private insurance companies. And sometimes people ask me, well, what is the difference between a Medigap or Medicare Supplement versus a Medicare Advantage? The main difference is when you join a Medigap or Medicare Supplement plan, you pay a premium, usually over $100, and then as long as the doctor takes Medicare, you can see any doctors. I am hearing more doctors are choosing not to take Medicare because they must accept Medicare's payment arrangements, and they're not supposed to balance bill after Medicare pays them. Also, oops, I'm sorry, I hit something and skipped my slide. Also, the Medicare Medigap plans do not include Part D coverage. So if you choose a Medigap plan, you will also need to choose a Part D Medicare prescription drug option if you don't have other credible coverage, and I'll go into that a little later. Under the Medicare Advantage plan, you are eligible because you have Medicare Part A and B, and then some plans have very low or no monthly premium, and they include Part D prescription drug coverage. But you would need to check to see if your doctor is in network with the plan, and then like if you call me and you want more information, I can check that for you. And then in some areas, there are Medicare cost plans, and they're offered through private insurance companies also. I don't think in this area there are many, if any, Medicare cost plans.
Pauline, I'm not sure if you have this coming up, but we did have a question asking what plan covers like emergency room visits or ambulance transport, or like patient first as well.
Okay, so all plans, Medigap and Kaiser's Medicare Advantage covers urgent and emergency care. I know with Kaiser, we cover it anywhere. So if there's a patient first nearby and you have an urgent situation, you can seek care, and then we will cover that. If it's an emergency, please call 911. Wherever they take you is covered, including if you're out of the country with Kaiser Permanente. Because we do not offer a Medicare Supplement or Medigap plan, I'm not sure about what their rules are regarding the urgent or emergency care.
Does Medicare cover dental?
Medicare does not cover dental at all, but Kaiser Permanente does give you a dental option on the options, all of the options that are available under Medicare Advantage.
Okay, and it looks like the last part of this question was to explain the copays.
Okay, so if you want specific copays, because we do have several options, give me a call, and that way I can mail you a complete packet of information that shows, you know, the different coverages and the copays, and then, you know, what the prescription coverage is and everything, and also answer any specific questions. Okay.
Okay, and just as a reminder, when I send out the link to the copy of the video for you to look at your leisure, I will also include Pauline's contact information.
Okay, thank you. Okay, so this slide talks more about the Medicare Part C. And what it covers. So it covers all of the original Medicare benefits and then also some additional benefits. So thank you for the question, because it also covers dental and vision. There's a transportation benefit and also a gym benefit. And there's different types of Medicare Advantage plans. There are HMO, HMO point of service, PPO, preferred private fee-for-service, and MSA. So with Kaiser Permanente, we offer what's called the HMO plan, but it's a little different because we have the medical center locations where there's primary care doctors, there's specialists, but then we do also work with some doctors in the community. So if you do have a physician that you would like me to check to see if they're in network, then I can do that for you. But if they're not in network, that would mean that you would need to change physicians. The preferred provider, or let me go to point of service. An HMO point of service plan, Kaiser does not offer anything but the first one. But if you have a point of service plan, usually the way that works is they have a in-network benefit where you would pay lower copays and an out-of-network benefit where you pay higher copays. With Kaiser, even though we do use some doctors in the community, your copays stay the same. And then a preferred provider organization, again, it's like they have preferred providers, you pay less. But if you go to other providers that are not in that preferred list, you pay more. A private fee-for-service plan is a little different because under that option, the doctor can choose to accept you as a patient one time, but then they can choose to not accept you another time. So every time you go to a doctor, they have the option of whether they want to accept the plan's fees for your care. And then lastly is the medical savings account. This type of plan, usually you pay a premium that goes toward a savings account, and that savings account is used toward your copays and medical costs. But again, if you're interested in any of the other options, you would need to find plans that offer those because Kaiser only offers the first option. Okay, the third bullet goes over some of the payments and costs. So when you join a Medicare Advantage plan, like sometimes people ask me, how can you afford to offer an option where I don't pay a monthly premium? But remember, you are paying a monthly premium because you have Medicare A and B, and you're paying that Part B premium. You just don't pay any additional premium when you join Kaiser Permanente. Medicare pays us when you join. So that's how we get paid, okay? And then again, if you choose an out-of-network provider, you're financially responsible, except if it's an emergency or an urgent care situation. And then the last little star is for hospice care and clinical research. That is covered when you're with Kaiser, but Medicare pays that for you, okay? And now on to Part D of Medicare. Part D of Medicare is the prescription drug coverage. And under Medicare Advantage with Kaiser, it does include the Part D prescription coverage. There are also standalone Part D plans. Kaiser does not offer a standalone Part D plan, but if you have a Medicare supplement that you're keeping, then you would need to find a standalone Part D plan. Also, you cannot have a Medicare Supplement Medigap plan and a Medicare Advantage plan at the same time. You would need to choose one or the other. And then also some people have coverage for Part D through their employer or union coverage. You can only sign up for Part D prescription drug coverage through private insurance companies like Kaiser Permanente, and you can only have one Part D prescription drug plan at a time. So for example, if you join Kaiser Permanente and we have the medical and the prescription all rolled into one plan, but later on, like I know we're approaching the annual enrollment period, October 15th through December 7th, if you enroll in another Part D plan, it will cancel your full coverage with Kaiser Permanente, since you can only have one Part D plan at a time. This chart shows the Part D premium based on income. This chart does not apply to Kaiser Permanente because under our options, for example, if you did the zero premium, we have a $25 option and a $142 option. And all of those options include Part D. We do not charge a separate premium for Part D. Okay. Okay, also, before I go to this slide, let me mention too, there is a late enrollment penalty for Part D of Medicare, which people are not that familiar with. I often meet people, say for instance, they had a Medicare supplement. When they first got Medicare, when they turned 65, they were not taking prescriptions. So they tell me, well, I don't have Part D because I wasn't taking prescriptions, but now I want to join your plan with Part D because I do need prescriptions. They don't realize that they will now have a penalty. The penalty is not accessed through Kaiser Permanente. It is given to them through Medicare. So it's a 1% per month penalty for every month they were eligible to get prescription drug coverage and didn't. So for example, if they waited a year, they would have a 12% penalty. And that penalty follows you for life, even if you change Part D prescription drug plans. If you have credible group insurance with prescription drug coverage, then you will not have this penalty, but Medicare is going to ask you to send them proof of what plan you had. And so if you did have group coverage with no gap prior to signing up for Part D, then you wouldn't have that penalty. But if you do have the penalty, like I said, it does go with you, even if you change Part D plans. So I often tell people it's better to get something versus nothing, okay? And so now this slide tells you more. Let me pause a minute. Any questions about anything I just said?
Nothing yet. Oh, wait a minute. Something just popped up. Let's see. It says, with telehealth visits during COVID on the rise, does Medicare cover this?
Kaiser covers it. Well, usually through Medicare, any coverage that you receive through Medicare is through a private doctor. And so if you're seeing a doctor, you would have to ask that office, how are they handling that? Kaiser Permanente has offered online visits and telephone visits throughout their history. We've been doing the Medicare Advantage plan in the Mid-Atlantic States region since the 1980s. And our telephone visits and our virtual visits have always been no charge and continue to be no charge. Okay. Are there any other questions?
Nope, I think we're good so far.
Okay, so this slide shows when can you join, switch, or drop a Medicare health plan or Medicare Advantage plan with or without the drug coverage. And so during the initial enrollment period, that is when you are first eligible for Medicare. And that's a 7-month period, 3 months before your birthday, the month of your birthday, and 3 months after your birthday, where you can join a Medicare Advantage plan. And then there's the open enrollment period that people are familiar with, which runs from October 15th through December 7th of each year. And that plan change takes effect January 1st. As long as you get the request in by December 7th. And then there's also a Medicare Advantage open enrollment period from January 1st through March 31st each year. If you're enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or go back to original Medicare during that time. And then I'm going to talk about some of the special enrollment periods also. So again, this slide covers some of the things I mentioned as far as the 7-month period when you're first getting Medicare, the annual enrollment period where you can enroll in a Medicare Advantage plan. And then there's also special enrollment periods, which are triggered by certain events and also triggered by star ratings. So the slide, the third bullet mentions, like if you lose employment, you can get Medicare and enroll in a Medicare Advantage plan. If you're moving, then you're eligible to enroll in a Medicare Advantage plan. I often get questions like, well, currently I live in Maryland, but I am planning to relocate to Delaware. If you ever join a plan like Kaiser Permanente and you move out of our service area, so the qualifications to join Kaiser Permanente is you must have Medicare Part A and Part B, and you must live in the Kaiser Permanente service area, which is DC, Maryland, and Virginia. But if you relocate, all you would need to do is call Medicare, and they will let you know what plans are available in your new area, and you are eligible to enroll since you are moving. Also, Medicare has a star rating. And so Kaiser Permanente has received the 5 out of 5 star excellent rating from Medicare for 9 years, but now we just found out we did get it for next year, so 10 years in a row. And that does give you a special enrollment period that you can join Kaiser Permanente at any time. So if you needed coverage, it could start as soon as October 1st. You don't have to wait till the October 15th through December 7th general enrollment period to be effective for January, okay? And then this goes more into detail about the late enrollment penalty I mentioned with the Part B of Medicare and Part D of Medicare, okay? Medicare also offers extra help to those that are eligible. And also, let me mention too that Kaiser Permanente is nonprofit. So based on income, we do also offer Copay Help. And usually if you qualify for the low income subsidy through Medicare, you also qualify for the Copay Help through Kaiser Permanente. The low income subsidy helps you with your prescription copays. And then the Kaiser Copay Help helps you with office visit copays. To find out if you are eligible for extra help, you can call Medicare, but the income range is usually for individuals. If you make $38,000 or less, you're eligible for extra help with your prescription copays and also with your prescription drug premium. So with Kaiser Permanente, if you join the $25 option, you will pay less because of that extra help, giving you a portion of that. If you have family income, if it's $51,000 or less, then you also will qualify for extra help. And again, if you contact Medicare, or you can apply online for the prescription drug help.
So Pauline, we did have a question. It says, is there any coverage for patients who are being cared for at home? And is there any coverage for the caregivers?
We don't have the caregiver coverage, and Medicare doesn't cover that currently, but they do cover, and we do cover home health care, but it's medically necessary. So usually with all health insurance companies, if it's home health care that you need, it's like maybe say you had a knee replacement. And then they said, okay, well, you need to get physical therapy, and we're going to send someone to your home to make sure that your bandages are changed and that you get your little physical therapy or whatever you need to recover 100%. So that is covered. But yet, if there's a situation where you need help dressing, bathing, getting in and out of bed, it's long-term care, and then the health insurance will not cover that for an extended period of time. Okay.
Thank you.
Okay, so these are the important numbers to have to check on getting your Medicare started. Most people you call Social Security, because then you're also starting your Social Security payment. But like I said, if you decide, because I know they have different levels where you get more money if you wait. And so if you do decide to wait, just know they are going to send you a quarterly bill for the Medicare Part B. And then there's also the number for Medicare. And this number you can use to check on if you've got any penalties, Part B penalty, and then also for getting information on the extra help. Both numbers can help you. I know sometimes it may be quicker to get through to Medicare directly because I know Social Security handles a lot more. And I'll let you know a little secret. What I found by doing this for a while is when you call Social Security, I know people get very frustrated because it's so hard to get through. And they say, tell me the reason why you're calling, press this button, sorry, I didn't get that. And so I found that when you call Social Security, if you don't say anything, this is a secret for being on this call today. If you don't say anything and you don't press any buttons, eventually it'll say, I'm sorry, I'm having trouble. Let me put you through to someone. So you don't have to go through any other hassle. Okay, and then also on this slide is my contact information. Again, take that down. And also where you see the My KP Agent / Pauline G, we are doing webinars. So you can go to that site and register for one of the webinars, and I will present the Kaiser Permanente plans. And then also, if you will call me with your mailing address, I can mail you the complete packet. So you can also have that available when you go to the webinar. Okay, so are there any other questions?
That was a great tip, Pauline, about the
Thank you.
And I'm going to guess that it probably works on other places too, because there have been places where I've just automatically pressed 0 and someone picks up, because you don't want to just keep pressing buttons and getting recordings and, you know,
right.
And eventually they will, a live person will answer, but that was a great tip. So thank you.
Thank you. Well, on behalf of Kaiser, thank you for letting me join you today. You have my phone number. Please call me with additional questions, and then also with the mailing address. If I don't answer, I'm pretty good about returning my calls quickly. So please leave a message with your name and phone number, and if you want a packet, leave your mailing address. And again, Susan and Adrian, thank you for having me today.
Well, thank you, Pauline. We really appreciated your presentation. And I do have a question. You know, here at Augsburg, we're a continuing care retirement community. So we have a lot of people here who are looking at moving to assisted living. And many times people say, what does Medicare cover if I live in assisted living? So I don't know if that's a blanket statement answer, or is there a guideline of what people could expect if they were living in an assisted living community? What might be the types of things that Medicare would pay for, such as, you know, a mobility device or incontinence supplies? You know, what kind of things might people expect Medicare to cover?
Well, in assisted living, Medicare would still cover the doctor visits. So the doctor that's rounding in that facility. Also, Suzanne, I know Kaiser, actually, we are looking at partnering with different places. So if you send me more information on that, just to be there and be available for the residents and have a nurse and doctor that goes to that facility to help people. And we realize that the people will not all be Kaiser members, but yet we are, because we're nonprofit, looking at other ways to get into the community. But Medicare will, you know, like when you say the, you know, incontinence supplies and things like that, they currently don't cover that. But like I know with Kaiser, we do give people a catalog allowance where they can order their incontinence supplies and other things.
Okay.
So, yeah.
Great. Well, this was very informative. I'm not quite there yet for Medicare. I got a little bit of time, but it's always good to know, you know, what's ahead. And you know, you hear always in the news, Medicare, Social Security. So for everybody who's watched and joined us today, I hope that you enjoyed Pauline's presentation and that you got some great information and answers to some of your questions. And as she said, you're free to certainly reach out to her privately after the presentation is over. I thank you again, Pauline, for spending this time with us. It was great to meet you.
Thank you.
And,
thank you.
Love to have you back someday. So, and hopefully we can do it in person. That would be even better. We're getting hopefully a little closer each month. And for everybody who's watching, thank you again for spending this time with us. I look forward to seeing you next time. We don't have any webinars planned immediately. We're working on one for October, late October, and it will be all about Augsburg. And so a little bit new and different presentation, and I hope you'll join us for that. And I wish you all a great autumn. Stay healthy, stay well, and we'll see you soon. Take care, everybody. Bye-bye.